Our goal here is to get you the newest information as it relates to the coronavirus crisis. We're about an hour in, and we have at least an hour, many hours to go because the situation is changing. I would like to bring in a doctor, Dr. Margaret Harris with the World Health Organization. Your organization, Dr. Harris, took the step to declare the coronavirus outbreak a pandemic. And again, tell me why.
So it's important to understand we didn't declare it a pandemic. We are now characterizing it as a pandemic. And it is a different distinction because it doesn't mean there are any legal things or any things that change. What's changed is the message. The message has gone from get ready to get serious.
Okay.
It's here now, and we've got to take action now.
I heard the head of the WHO refer to alarming levels of inaction. What is he referring to, and where is that being seen?
We're really concerned that in some countries, the health authorities or the governments or the local authorities are not taking surveillance seriously. Now, what surveillance is working out who has possibly got the virus and testing those people, but also checking all the contacts, all the people around them who may have been exposed to that virus, because that's the point at which you can stop spread. If you know that people have got it, and if you ask those people to stay in quarantine, to self-isolate, you've got a very good chance of stopping or at least slowing your outbreak to the extent that you've got the opportunity to deal with the people who get very sick, so that you don't have a situation like what we're seeing in Italy, where you've got 900 people desperately ill in intensive care, doctors and nurses overwhelmed, and people who get sick will not be able to be treated.
Dr. Harris, you're speaking to us live from Switzerland, and I appreciate that so much. I will give you a for example that's happening here in the United States. In the city of San Jose, a large airport, San Jose International, was found to have 3 TSA screeners, security screeners, to have confirmed cases of the coronavirus. When you think about an international airport situation, someone at the security line checking, I don't know how many hundreds or thousands of people with each workday, how can you possibly go back and figure out what people each one of those screeners came in contact with in the days before he or she was diagnosed with coronavirus? How does that happen?
So that is extremely difficult. The good part is the people who were infected have been identified. But now this is where you really rely on risk communications, where you rely on informing the public and telling the public what to do. So if you did come into contact, or you were traveling through the airport at the time, don't panic, but recognize that you may be a contact. So look out for symptoms and take precautions. Isolate yourself from your family. Don't share the same utensils. If you can, don't share the same bed space. Do that for 2 weeks to protect all those you love. And ideally, you won't develop the virus, but you will stop the spread. If you do develop the virus, it won't go to other people.
Airport officials haven't said where in the airport these 3 contaminated workers were working. They haven't said what days they were working. People who rely on the San Jose airport are understandably frustrated because they don't know, I passed through there last week, am I in danger? I was there 2.5 weeks ago, am I okay? Can you understand the frustration people are feeling because they're not getting answers that could help calm their fears?
And certainly the advice is to give good, clear information. So I can't particularly comment on the situation because I haven't been involved, but all the evidence for good risk communication is you should be transparent, you should tell people what they need to know, help them take action that they really can take, because at this point our health is in our hands. We really need, every one of us needs to know what to do and to do it.
It sounds like things are going to get worse before they get better. Would you agree with that assessment?
We are going to see an increase in cases. That's why we are now characterizing it as a pandemic. We do expect to see very large outbreaks in many countries around the world. So again, it would be great if we're wrong. It would be fantastic. And we will be wrong if everybody takes action, and that would be a great outcome.
All right, Dr. Margaret Harris with the World Health Organization speaking to us live today from Switzerland. Thank you. I do hope to fold you back into our live coverage here, as many people appreciate hearing directly from the World Health Organization.